Okay, so we're going to continue our discussion of monogenic disorders in childhood with hemophilia, another disease you should be familiar with from Nursing 317. Classic hemophilia is a monogenic disorder, and again, it's a large gene, so any weak point in that sequence of bases, which codes for the factor VIII clotting factor, that F8 gene, can cause classic hemophilia. When the disease is inherited from a carrier to an offspring, it does follow an X-linked recessive pattern. It is found on the X chromosome. Incidence is about 1 in 5,000 live births, almost exclusively males. Occasionally, females are affected with hemophilia. It does occur in all races and ethnicities. It has a high spontaneous mutation rate or de novo mutation rate, meaning that in about 25 to 30% of individuals affected with hemophilia, the mother is not determined to be a carrier. It is something that happened in the egg cell that created that human being. And again, there are, a larger gene is a bigger target. There are places on the F8 gene where mutations can arise. Signs and symptoms. Female carriers may have lower than normal factor VIII levels because of X inactivation, just like with Duchenne muscular dystrophy. They might bruise and bleed easily, so that might be your first clue. Other signs and symptoms are, bleeding in infancy or bruising as the developing child falls or bruises. You'll see excessive bruising, excessive bleeding for cuts. Over time, you'll get excessive joint damage in the weight-bearing joints of the hips, ankles, and knees, because sometimes with overexertion, you get a little bit of bleeding into that joint capsule. In a person who has factor VIII, it's resolved quickly, but in a person who does not, that bleeding can be extensive and will cause damage to those tissues. Disease variability is based on the levels of factor VIII, so it kind of depends on which mutation you have. Life expectancy, if you have access to factor VIII therapy, is about 65 years. Again, though, we have higher incidence of traumatic brain injury with severe bleeding, and other things can occur. And this is your Punnett square. You can see you've got a mom who's a carrier on this axis. You've got a dad who has normal genotype on this axis. And the typical pattern for girls, if you inherit a normal X chromosome from your dad, normal one from your mom, you won't be a carrier. But if you get that recessive allele from mom, who is a carrier, you will also be a carrier. With boys, the pattern is either you get mom's normal allele and you make factor VIII, you are not affected at all, or you get mom's altered F8 gene and you will have the disease. Okay, and this is pedigree analysis, and this kind of shows you the importance of a pedigree. This was actually the European British royal family, and you can see that it happens in every generation. We have either a carrier or an affected male. Females do not have the disease. They are considered to be carriers, and they have children, male children who are affected by the disease. And that's a common pattern for X-linked recessive inheritance. The males are affected, females are carriers, and it occurs in every single generation where carriers produce offspring. Okay, so signs and symptoms for the child: bruising and excessive bleeding in response to any trauma during infancy. Those little falls when they learn to walk can result in excessive bruising. Any little cut or scrape will result in excessive bleeding. Petechiae, which are actually tiny little microclots, do not form in areas of trauma. Again, the extensive joint damage in the weight-bearing joints. The diagnosis is usually based on a history of excessive bruising and bleeding. If a child comes in with excessive bleeding, this is something that they might look for. If you have a known family history and your pedigree reveals that pattern of inheritance, they can do F8 gene sequencing. F8 gene sequencing can also be used to identify the specific mutation and to determine whether the mother is a carrier or if it's a spontaneous mutation. And if female siblings of affected males carry that altered gene as well and are themselves carriers. Okay, management, regular infusions of factor VIII. Factor VIII is one of those things we can actually replace in the body, and so this doesn't have to be as devastating as something like a muscular dystrophy where we can't replace the dystrophin. Liver transplantation can result in a cure, but it's rarely performed because it's very invasive and there are more cost-effective, less invasive treatments for hemophilia. Lifestyle management is going to include avoiding anything that might trigger bleeding, and replacement with desmopressin or factor VIII before procedures that we know are going to cause bleeding. So contact sports are out. Anything to prevent injury, seat belts, helmets, shin guards, and really sort of guiding that person into a non-traumatic physical activity like swimming could be important in the treatment of classic hemophilia. Okay, and that is it for hemophilia. We're going to pick up with achondroplasia next.